Welcome to HealthCurrents, a program about the services, programs, and people of Riverside Medical Center. I'm Carl Maronich, and joining us today is Dr. Mehmet Sipahi. Dr. Sipahi, welcome.
Thank you.
Dr. Sipahi is a medical oncologist with the Rush-Riverside Cancer Institute. And Dr. Sipahi, I want to start by congratulating you. Recently, you received the Good Heart Award from the Riverside Foundation. Congratulations. An honor for your span of service. And to talk a little bit about how it felt to get that award.
Thank you. It was a very exciting time for me and members of my family. I was, of course, surprised. And it's not something that you work for when you're a physician. You work for the welfare of the patients, and you try to serve the profession. And I have received so many congratulations from my patients and friends that it was truly an honor, and I appreciate it.
Very good. I know one thing the Rush-Riverside Cancer Institute prides itself on is the team approach that it takes to serving the patients. Talk a little bit about the team that surrounds the patients.
Well, all the things that we have done here would not have been possible without the team concept. Care of cancer is divided into two basic groups. There's medical oncology / hematology, and there's radiation oncology. So this whole team, takes dedication to treat a patient.
That has to be a benefit to the patient to have such a team. There are quite a few people you mentioned there.
That's right.
And different types of care that the patient receives.
That's right. Oncology, hematology is not a one size fits all. Every patient is individual, and even though they may have the same malignancy as the patient before, you have to make adjustments for the patient's various demographic features.
Sure.
So we try to individualize it as much as we can, but staying well within the guidelines established by the standards of care throughout the United States.
I know much of your career here at Riverside, you've spent time down in Watseka.
Well, I started there in 1988. I was actually the first oncologist there. And we are there to deliver care that's given locally with a national flavor. And we do not shortchange anyone that comes to Watseka Clinic. They get the same treatment that they get here in Kankakee, and we here in Kankakee give the same treatment in Chicago. Like I've said, we're all members of the same family, and we all each deserve the same attention, the same care, and same compassion.
Sure. How the patient is served by that treatment has to be improved if they're doing it close to home, I would think.
Yes. I mean, as opposed to driving 30, 40 miles, 3, 4, maybe 10 miles at most. Right. They don't have to spend all that time on the road. Yeah. If they have any side effects, we are there. It's almost 24/7 care.
Yeah, that's a big benefit. Doctor, before we ask our final question, we're going to jump over to Judy and have her give us a HealthCurrents update.
Thanks, Carl. Well, this past weekend, Kankakee Relay for Life took on storms, wind, and rain, but we also raised over $280,000 towards the fight for cancer. Riverside was a major sponsor, and we were excited to be part of the Celebrate, Remember, and Fight Back efforts for the county. Wednesday, June 20th, the Coal City campus will host the Diabetes Wellness Open House. Join Dr. Lardy as she tells you how you can live with diabetes. Did you know that this year more than 2 million people will develop skin cancer? With June 21st marking our first full day of summer, be sure that you're wearing SPF 30 or above sunscreen as recommended by the American Academy of Dermatology. Thanks, and back to you, Carl.
Well, Doctor, I also wanted to ask you, recently we just had the Relay for Life, which is a big event locally, but events like that have really increased the amount of cancer awareness, I think, over the years. Are you seeing that in your practice? And I would think that has to be a good thing.
Yes. First of all, Relay for Life here in Kankakee County has been a tremendous success. We must congratulate them for all their effort throughout these years. We want not only the cancer patients, but the members of the community at large to be educated about cancer, about ways to prevent cancer, about ways to detect early warning signs of cancer. And we want them to be able to feel free and comfortable in seeking treatments here at Riverside Medical Center. And the more that people are made aware of our services, I think the better it is for everybody.
Sure, very good. Dr. Sipahi, we appreciate you joining us on HealthCurrents, and we look forward to having you back another time.
Thank you very much.
And remember to stay healthy, stay current, and stay tuned to HealthCurrents from Riverside Medical Center.